Welcome. Today we're delving into a complex and often devastating condition affecting the eyes, radiation optic neuropathy, or RON. This video will explore what causes it, how it impacts vision, and what can be done to manage this challenging diagnosis. Radiation optic neuropathy, as the name suggests, is caused by exposure to ionizing radiation. This typically occurs during radiation therapy aimed at treating tumors located near the optic nerve and chiasm. Common tumor sites include the brain, sinuses, and nasopharynx. The closer the tumor and the higher the radiation dose delivered to the optic nerve, the greater the risk of developing RON. While radiation therapy is a life-saving treatment for many cancers, its proximity to delicate structures like the optic nerve can unfortunately lead to this complication. The pathophysiology of radiation optic neuropathy involves a cascade of detrimental events. Ionizing radiation damages the small blood vessels supplying the optic nerve, a condition known as radiation-induced vasculopathy. This damage leads to ischemia, or a lack of blood flow, depriving the optic nerve of essential oxygen and nutrients. Over time, this can cause optic nerve atrophy, which is the gradual wasting away of the nerve fibers responsible for transmitting visual information to the brain. Additionally, radiation can directly damage the glial cells, the supportive cells of the optic nerve, further contributing to its dysfunction. The precise epidemiology of radiation optic neuropathy is somewhat difficult to determine, as it often goes underreported or is attributed to other causes of optic neuropathy. However, studies estimate that the incidence ranges from 0.5% to 20% in patients undergoing radiation therapy near the optic nerve. The risk is influenced by factors such as the total radiation dose, the dose fractionation schedule, and how the radiation is divided into multiple sessions. An individual patient's susceptibility, those with pre-existing vascular conditions, such as diabetes or hypertension, may be at a higher risk. The signs and symptoms of radiation optic neuropathy can vary depending on the severity of the condition and the location of the damage. The most common symptom is painless vision loss, which can be gradual or sudden in onset. Other symptoms may include decreased color vision, visual field defects such as blind spots or peripheral vision loss, and occasionally, pain in or around the eye. Symptoms typically appear months or even years after radiation therapy, making early detection a challenge. Diagnosing radiation optic neuropathy requires a comprehensive ophthalmological examination. This includes assessing visual acuity, color vision, and visual fields. An examination of the optic nerve using an ophthalmoscope can reveal pallor or swelling. Imaging techniques such as magnetic resonance imaging or MRI are crucial to rule out other causes of optic neuropathy, such as tumor recurrence or compression. Visual evoked potentials or VEP can also be helpful in assessing the function of the optic nerve. Fluorescein angiography can reveal vascular abnormalities in the optic nerve and retina. While there aren't distinct classifications or types of radiation optic neuropathy, in the same way as some other diseases, the condition is generally classified based on its severity, ranging from mild visual field defects to profound vision loss. The timing of onset after radiation therapy can also be a distinguishing factor, with some cases developing relatively quickly, while others manifest years later. Unfortunately, there is no definitive cure for radiation optic neuropathy, and treatment primarily focuses on managing the symptoms and preventing further vision loss. Corticosteroids may be used to reduce inflammation and improve blood flow to the optic nerve, although their effectiveness is limited. Hyperbaric oxygen therapy, which involves breathing pure oxygen in a pressurized chamber, has shown some promise in improving oxygen delivery to the damaged tissues. Anti-VEGF injections, commonly used to treat other retinal vascular diseases, may also be considered to reduce vascular leakage and swelling. In severe cases, low vision aids and rehabilitation may be necessary to help patients adapt to their vision loss. The best way to prevent radiation optic neuropathy is through careful planning of radiation therapy. This involves using techniques that minimize the dose of radiation delivered to the optic nerve and surrounding structures. Intensity modulated radiation therapy, or IMRT, and stereotactic radiosurgery are advanced techniques that allow for more precise targeting of the tumor while sparing nearby healthy tissues. Close monitoring of patients during and after radiation therapy is also essential to detect early signs of optic nerve damage. The prognosis for radiation optic neuropathy is variable and depends on the severity of the initial damage, the response to treatment, and the overall health of the patient. In many cases, vision loss is permanent, but some patients may experience stabilization or even slight improvement with treatment. Recent research is exploring the use of neuroprotective agents, which aim to protect the optic nerve from further damage. Stem cell therapy is also being investigated as a potential future treatment for regenerating damaged optic nerve tissue. Further research is needed to develop more effective therapies and improve the long-term outcomes for patients with radiation optic neuropathy.